good morning, good afternoon, and good evening to you all. I can see we have a lot of participants still joining us on the call today. I know we've got people from around the world as well, so thank you for joining us. I'm sure for some of you maybe not the most convenient time, but we appreciate your participation. My name is Katie Carroll. I'm the Global Secretariat for the Public-Private Partnership for Handwashing. With me today is my colleague Hannah Woodburn, who's our Communications Director. We're also very happy to have Jelena Vojcic with us from University at Buffalo, who's going to share a presentation as well. We are thrilled with the response that we received for this webinar. We had over 150 registrants, and I think that just really shows how much of an interest hand washing is to many people around the world, and we're excited at the partnership to see every year new organizations of people working in this area. So thank you for your interest and participation today. As you can imagine, we are sharing this, these think tank results with you as an event we had last month. It was a two-day event, so condensing it into an hour webinar with time for Q&A is a bit of a challenge, but we're going to try to share as much with you as possible today. We also will share links to the full presentation. Some of you may have already seen those on our website, so there is an opportunity to learn more if there's something of interest to you that we present today. We really try to focus today on highlights from the think tank that are most relevant to practitioners on the ground. What are sort of the practical things coming out of the think tank that may be helpful to you? We're going to try to present in about 40 minutes and then leave time for questions and answers and give you all an opportunity to give feedback and input as well. As there are many next steps to take from some of these findings, we want to make sure we get broad participation and input. I do want to just take a quick moment to talk about the partnership itself, which hosted the think tank. For those of you who aren't familiar with us, we are a partnership we have 10 steering committee members, and I'm just going to read off that list of names quickly, including USAID, UNICEF, the Water and Sanitation Program, Unilever, Colgate-Palmolive, Procter & Gamble, FHI 360, the Water Supply and Sanitation Collaborative Council, University at Buffalo, and the London School of Hygiene and Tropical Medicine. So we have a very diverse group of steering committee members, and while there are 10 of those, we actually engage with a much broader group of actors and organizations in the water, sanitation, and hygiene sector, which we refer to as the WASH sector, in case you hear me use that acronym later. And the partnership itself is staffed by myself and Hannah. You can see here our vision and objectives, our vision being proper hand washing with soap at critical times to be universally recognized, promoted, and practiced as fundamental to good health. I'm sure many of you have the same vision. And our objectives are really focused around advocacy and knowledge leadership. I'm going to talk a little bit about our advocacy work later in the presentation, but one of our big activities in this area is Global Handwashing Day, which many of you are probably familiar with and celebrate each year. The partnership created Global Handwashing Day. It's going to be the seventh year this year that will be celebrated, believe it or not. And we try to set the theme and provide tools and resources to those celebrating. In addition, in advocacy, we go to events and advocate for hand washing to be on the agenda and for organizations, governments, donors, and others to invest and focus on hand washing. On the knowledge leadership side of things, we really try to track and learn from the hand washing programs that are out there and try to figure out what's working and what's not. With that, trying to move these best practices forward and move the sector forward as we continue to learn from our experiences and research. The think tank is part of our work in this area to do that sort of checking in with the sector to see what we've learned. So our think tank objectives for the meeting that we had last month were to take stock of the best, to identify the gaps, and articulate the way forward for hand washing behavior change. And this is actually the second think tank we've had in recent years. We did another one in 2012, and I think everyone thought it was very valuable, and we committed to doing it on a regular basis going forward, bringing together people and then sharing results more broadly through this webinar and other methods. I think it's really important that we as a sector continue to check in regularly and learn from each other. So for today, these are the topics that we're going to cover. These were topics that were discussed at the think tank. I'm just going to share highlights from each one of these. If you have questions as we go along, feel free to just jot them down and ask them at the end, or you can jot them in the chat box and we can go through them at the end as well. But we just like to get through the presentations as quickly as possible so we can leave plenty of time for those questions and answers at the end. Right now I'd like to turn it over to our friend and colleague Jelena Wojcic at University of Buffalo. She presented at the think tank an overview of the hand washing literature that's been published over the past couple of years. It's always one of the highlights of the think tank. We've asked her to do a condensed version for today, and you can see her full presentation from the think tank on our website as well. But now let's try to turn it over to Jelena.
Good morning, good afternoon, everyone. Like Katie said, thanks for joining. My name is Jelena Wojcic. I am a research scientist at the University of Buffalo in the School of Public Health and Health Professions. And my hope is to share with you, like Katie said, a condensed version of some of the literature that's come out on hand washing in the last 2 years, so the year 2012 and the year 2013. We also did this at the previous think tank for the previous 2 years of that think tank. So if that is a good resource to you, I believe those slides are up as well on the partnership website. In 2012, there's been an update of the global disease prevalence of causes of childhood death. So this is important for the sector because we really think about what is hand washing, what is WASH doing, what is it preventing. So here I've highlighted for you diarrhea and pneumonia. Both have decreased since the last estimates, which I believe were in 2005 or 2007, which is a great sign. However, they still remain high, and they still remain together the leading causes of childhood death. From this paper, you can also see regional breakdowns, but I haven't presented that here today. Here are a few more estimates that have come out recently. This is more about episodes from Fisher Walker and colleagues in the Lancet series on diarrhea and pneumonia. There are a few estimates that are very helpful to understand what the percentages mean. So this gives you episodes, numbers of people affected. As you can see here, they are still quite high. The authors point out that for both diarrhea and pneumonia, these proportions are the highest in the first 2 years of a child's life. We also had an additional paper from Sanya Ashraf and her colleagues at ICT-DRB and in Pakistan, and they showed that in a study also done in Karachi, Pakistan, there was a 6% increased risk of a pneumonia for every additional day of diarrhea for a child under 5 years old. I think what this means for hand washing programs is for you that it's not really a surprise, is that there's dual benefits to hand washing. Now this is a paper that came from the WSP work. This one is specifically from Vietnam, and I've included this because this is an example of a large-scale program, and there are very few, if none, at this time, evaluations of large-scale programs. Some are underway, but this is the one that's been published recently by Chase and Doe, and it's a WSP policy research working paper. This was a cluster randomized control trial evaluating an at-scale WSP program in Vietnam. So this program reached about 1.5 million people, targeting caregivers, and the evaluation was done in a subset of those households, about 3,100. What they found was there's slightly higher availability, after this program, after they launched their program, they found slightly higher availability of hand washing materials in those households that are exposed to the program, but observed hand washing behavior was low and not different between those who received the program and did not receive the program, and thus they did not see an impact on health or productivity. At the end of the presentation, I'll discuss some of the implications of that. And there were two large reviews done last year, one on the effects of hand washing in flu or acute respiratory syndromes, and you can see here the authors broke it down by setting, schools, child care setting, and squatter settlements, and they show a variability in the quality of evidence and a variability in the health effects. And what they concluded is that it is important to think about, when we think about the effects of hand washing on flu or ARI, it is, from the evidence that's available thus far, dependent on the settings and where they come from. There's also another great systematic review by Dinger and colleagues that reviewed the effects of WASH, so inclusive of hand washing, but WASH broadly, on nutritional status, and found that the current evidence on the effect of the weight for age z-scores, the weight for height z-scores, were not significant, so there was no effect. And there was a borderline significant effect for the height for age z-scores. However, all these studies were of low methodological quality, and currently there are larger trials underway to really understand these relationships better. And regarding some evidence for hand washing and child development, we have a paper from Anna Bowen and her colleagues at CDC, where from a randomized control trial in informal settlements in Karachi, Pakistan. And what they've reported is that the global development quotients were 0.4 standard deviations greater in children from households that received hand washing promotion for 3 months than the control group. Excuse me, for 30 months. That was blocking my screen. Than the control group. And the authors concluded that these gains were comparable to at-risk children enrolled in publicly funded preschools in the U.S. They did note that the child growth was not different between groups, but this is what we see a substantial contribution to understanding this relationship a little bit better. Also by Anna Bowen and her colleagues in the same study, I believe it's the same study, it's a study done by Steve Luby and his colleagues, and that was published in Lancet in 2005. They published a 5-year follow-up of their work. And what they found was intervention households, so again, those that received weekly education and supervision for about 9 months, were 3.4 times more likely to have soap at the hand washing station, had higher knowledge of critical times, and reported purchasing soap more compared to those that did not receive the program. So this suggests habituation of improved hand washing practices, but from these methods we can't be certain because these are, again, proxy indicators for behavior. And thus far there is very little evidence on long-term behavior, impact on long-term behavior of any hand washing interventions. From a lot of the WSP work in Kenya, Vietnam, and Peru and Senegal, there's been a number of hand washing determinants that they've defined. It's a large list, and this slide is very dense, but I just wanted to briefly show this to you. This is the list of motivators. I'll leave this to you to kind of go through on your own because it is a large list. There's also a large list of barriers. A lot of these barriers that you can see are, some of them are structural barriers, some of them are much larger than an intervention can support, for example, poverty. However, there's a number of structural barriers that are important to note. This relates to the next topic that we talked about, which is behavioral theory. Robert Dreibelbis and his colleagues, they did a systematic review of looking at frameworks and models aimed at guiding behavior change interventions. And they found 15 existing models. But what they found was that they underrepresent the role of technology on behavior change. So some of those structural barriers that you saw on the slide before, here we're finding that in these behavioral theories, we're really not thinking about those types of barriers and the role that technology has on behavior. So these models really focused on these individual level outcomes, and they really ignored the physical and broader environmental determinants. So what this group did was develop a broader framework, which is the next slide. It is pretty comprehensive, but what I'd like to show you here is how it's structured. So this is what Robert Dreibelbis and his colleagues developed. It's the Integrated Behavioral Model for Water, Sanitation, and Hygiene, IBM WASH for short. This includes hygiene, but also other components of WASH. And really, what I wanted to highlight here is that they've broken down the way we think about behavior related to WASH into 5 levels, which you see on your left: societal or structural, communal, interpersonal or household level, individual, and habitual. And then they put these across three different factors: contextual factors, psychosocial factors, and technological factors. And what this is helpful for is to really guide people in a very comprehensive way, thinking through how they are affecting hand washing behavior. So thinking through some of these behavioral components, which in most programs already exist, but kind of putting them into perspective of where they are and how they're aiming to affect hand washing behavior. There's not been a lot of headway in improving measurement of hand washing behavior. The progress is very minimal. There has been one paper in the last 2 years published by Mulholder and his colleagues at ICDDRB about structure observations, which just briefly are direct observations of hand washing behavior. We know them to be quite resource intensive, but also is currently the best method to measuring behavior. And what they did was compare, let's see, if you do a shorter observation, a 90-minute versus a 5-hour observation. And what they found is that there's a disproportionately lower number of fecal contact events. So going to the bathroom, cleaning a child's bottom, touching animal feces, etc. Also eating events in the 90-minute observation. So if you're technically seeing less things, which means that you can, which gives you much less power to understand what you're trying to understand. And again, soap was more frequently used in the 5-hour structure observation. So it gives you a different understanding of the behavior based on how long this observation is. I think this is a lot more technical than most people would like, but this is just to kind of highlight, this is a question that comes up a lot. How long should an observation be? Does it matter? And here we have evidence of, shorter versus longer. So this is a summary of some of the implications of recent research, and again, this means in I reviewed for 2012 and 2013. The data still shows that diarrhea and pneumonia are large global health problems. Although it's getting better, it hasn't gotten good enough for all of us to say, "Oh, job well done." There's an important trade-off between scale and intensity of hand washing promotion programs, which is what we saw in the WSP work. And we still need evidence of effectiveness of hand washing at scale, which I believe there are a couple of trials underway to help us with that understanding. Moving beyond health messaging, there was a number of motivators and barriers that were identified. And it's clear that trying to engage in more than just health-related approaches is very important for behavior change. Including structural or environmental factors or the technology factors that influence behavior was an important part. We saw through the behavioral theory and also through an understanding of the barriers. And better measurement of hand washing behavior, which is the same conclusion from 2 years ago, is still needed and would be very helpful to the sector. And for the last one, designing interventions to promote hand washing habit and long-term behavior. I think this is related to going beyond health messaging is how we think about hand washing behavior. I think there's been an incredible movement from just doing health messaging to really thinking about hand washing as a behavior on its own and then thinking about habit and really now focusing on long term. There are no results to support that as of now, but I think that's, from what I understand, I feel that the sector is moving in that direction. So I'm happy to answer any questions, and also please feel free to contact me by email, which you see on your screen.
Wonderful. Thank you so much for that quick summary. Yelena's full presentation is available on our website, which we'll share a link with at the end of this. And if you can just type your questions in, we'll address them at the end. I just struck by a couple of things from your presentation, including the fact that we still struggle to find the evidence of hand washing behavior change at scale. I think this is something that the entire sector struggles with. We do have some findings or outcomes from the think tank that I think are promising as far as some progress in that area, but I think that continues to be a challenge for all of us. The other encouraging thing I find is that there's more research going into the effect of hand washing on things other than diarrhea and pneumonia, which are well established, but people looking at the impact on child development. I know helminth infections has been looked into. I think there's other potential impacts of hand washing, and I think the more we can pull those out, the better case we can make for governments and donors and others to invest in it, especially in areas where perhaps diarrhea and pneumonia aren't the biggest issue, but there are other more quality of life issues that hand washing could impact. One thing we did come out of this session with was a suggestion by Darren Saywell at Plan was to sort of have a map of this evidence in the different areas of hand washing behavior change to show us what we've learned and what has yet to be determined, so we can sort of map our progress in the understanding of these various elements of hand washing. So that's something that the partnership is committed to try to take forward in the future. Great. Well, thank you, Yelena, again for the presentation. That was great. And we'll come back to you at the end for questions. the next topic from the think tank was hand washing products, and I wanted to share with you a couple of top line highlights from that session. And I just want to mention also we have a few people who've joined us who were actually at the think tank. So as I'm presenting, if there's things that I'm forgetting or anything else you want to add, please jot down a note, and we can let you do that at the end of the presentation. On hand washing products, as Yelena mentioned, one of the studies showed that many behavior change models or frameworks that people use to design their hand washing program don't really address the issue of products. And we're talking about soap, water, and a device for hand washing. There was some agreement in the group that having a product alone is not going to change behavior, but it is a really important component of hand washing, especially when we think about sustaining hand washing over the long term. We heard from a couple programs about the tippy tap technology, and I'm just going to try, for those of you who may not have seen one before, I'm just going to try to link to a picture I found online, which you should be able to see now. This is just how to build a tippy tap, but it's basically an empty container that you can put up and use and refill to have hand washing, and it's often promoted as a way to start people washing their hands and make an easy device for it. But we found from some of the presentations that over a long period of time, these tippy taps were often not used, or they broke down. They weren't very durable. So there are some issues with tippy taps, and I think that brought up the issue of, what's sort of the longer term solution if people are going to be washing their hands many, many, many times a day as we'd like them to. That's something that's a little bit more sustainable in the home. So that issue on the products was an important one that we chatted about at the think tank. There are a couple examples of more durable products on the market, hand washing devices on the market that are being tested. In the Philippines, with the Fit for School program, they are testing a sort of group hand washing station that's out of the box. So something that is modular that you can ship and people can construct easily wherever they may be. So looking at some kind of product that can be sent somewhere and set up, and it's made of durable goods to have a group hand washing station where multiple people can wash their hands at the same time, which is appropriate for schools. It could be appropriate for emergency situations as well. So they're working on that and testing that as well. In addition, there are 2 other sort of household commercial hand washing stations that are being tested in a couple of markets. I wanted to share those with you today. These are just excerpts from some of the presentations we saw. So in Kenya, the WSP program has designed something called the Marembo, which means the beautiful one in Swahili. It's a hand washing station. As you can see here, this is just their prototype that they've further refined, but it's basically a hand washing station that mounts on the wall, and it has a mirror, which I think is a really interesting new twist on the hand washing device. They did a lot of testing and development and different types of products, and this is the one that they found the best response to from the target market. And you can see the idea of having this mirror is something apparently that is highly desired by people. It's not often affordable or available in the home, so it provides this place that draws people to the device, and it can also serve as a cue by drawing people there to wash their hands. So it's really kind of an interesting new design for a hand washing station. And then this is the current design that they have. You can see at the top there's this round mirror in the design as well. So they are working on developing prototypes and testing it in the market. But that's one interesting device that folks are trying to get on the market. And it's nice, it's new, it's hopefully somewhat durable, and something that is a bit aspirational for people to have in their homes. The other example is the Happy Tap in Vietnam that was developed with Watershed and USAID, I think some other partners as well. But they've really gone much further. They've designed the product, tested it, and now they're actually getting it into the market and seeing some sales from their marketing efforts. So people are responding and purchasing this item for their home, and it was really designed to be a more aspirational, what they call a fancy product that people would like to have in their home that sort of has a status associated with it. They did a lot of research on everything from the colors and the design. You can see here their main logo, the message is convenient for hand washing, beneficial for health, and they found that those messages were what the market really responded to when they were doing their testing. In addition, they're doing something innovative with the packaging for the Happy Tap and making the actual packaging nice and attractive as well, but also can be reused as a wall calendar and as a game for children to further encourage and serve as a cue for hand washing in the home. So another interesting product that's coming onto the market in Vietnam. So those are a few highlights from the hand washing products session. Next we have our social norms session. We actually had a guest from the University of Pennsylvania from their behavior lab come and give us a little crash course on social norms and helped us think about how we can change social norms around hand washing and some of the opportunities there. For those of you who may not have heard the term before, I'm sure you know what it means when I explain it, but a social norm is a rule that applies to a certain situation, and you follow the rule if others do and if others think that you should. So an example would be, that the social norm in my community is that everybody washes their hands after using the bathroom. So I know that other people are doing that, and I know that they expect me to do that as well. So it's a social norm around hand washing is a determinant. It helps determine if people are washing their hands, and I think really helps to keep hand washing as a sustainable behavior, because if everybody in the community is doing it and expects you to do it, you're much more likely to be washing your hands. So we talked a little bit about what social norms were, and then there were some learnings from other efforts to successfully change social norms in other areas, such as female genital mutilation. That was one area of social norms we looked at to have some learnings that we could apply to hand washing. One learning on social norms was that if there is some behavior happening, if there is some hand washing behavior happening, just letting people know that it's happening can help increase behavior change. So, for example, if they did a survey of the community and found out that 30% of people 50% of people wash their hands after using the restroom, just sharing that information with people helps others realize that this is happening and this is something that I should do in the community. So that simply informing alone, if there is some good behavior happening, can help improve a social norm. Another learning was that it's really important to engage what they call the reference network, but those are basically people who influence those people who you want changing behavior or hand washing. So if you're trying to engage mothers, who's influencing those mothers in the community? Are there certain social leaders or people they look up to? Making sure to identify and think about who are the influencers of the person you want to change behavior. Another really important learning was making the behavior visible. That's a really important element to creating a social norm. And it's a difficult challenge for hand washing, obviously, because often it's done in private or within the home where you're not seeing it in society. So we're sort of challenged in the think tank to think about how to how to make hand washing more visible, and came up with some pretty creative ideas, like if somebody buys soap for hand washing, they get a free whistle that the children can play with. So if children have whistles and you hear that sound, that family is buying soap for hand washing. And I think that's a challenge for the whole sector, so think creatively about how excuse me, about how we can make hand washing more visible in the community in creative ways. And then also thinking about beyond just the person washing their hands, who else's behavior has to change in order to help that happen. So if it means that we're trying to get mothers to wash their hands, but if that means that we need the fathers to help maintain or fix hand washing stations in the home to do that, then they have to be that behavior has to be engaged as well. So I think that was a very good challenge of what other supporting behaviors have to change in order to allow people to wash their hands. Two other things quickly, because we're already running way behind on time. It's easier to build off an existing social norm, so if you think about any related social norms that exist and building off of that can be easier than starting a whole new social norm separately. And then the power of collective discovery, and the presenter of the session shared a couple of helpful slides on the collective discovery, which is a method that's used in sanitation a lot, which is if I'm sitting here, and he gives a very US-based example, but if I sit here and watch my television and see a speech by the president, I'm getting some information by myself. It's very different than if I'm in this crowded stadium listening to the speech. I'm hearing the message, I'm seeing that everybody else is getting the message, and they're seeing that I'm getting the message. So I think this is really about, having the community as a whole seeing the change and seeing that others are also getting the same message. And that's worked very effectively in the sanitation sector as well. Okay, and then on to sanitation and hand washing and sanitation. We had some really great findings here. I think we've seen the most success in hand washing behavior change as it's integrated into sanitation programs. We've seen it from the presentations. We saw it successfully. It was integrated into a sanitation program. And here we're talking mainly about, as UNICEF refers to it, community approaches to total sanitation. It's also referred to as CLTS, or community-led total sanitation efforts that are really moving people from open defecation to improved sanitation. When we've seen hand washing integrated into those efforts, we've seen a lot of success. There was a program presented from WSP where they had promoted sanitation and separately a hand washing promotion program. So they were done, both programs were done in the same community, but they were done at different times. And those programs didn't actually see as many results as when hand washing was an integrated part of the sanitation program. So that was, to me, a kind of interesting learning about how to talk about hand washing in relation to sanitation. It has to be part and parcel of that sanitation message. UNICEF presented some very interesting findings. They have created some new hand washing triggering tools, and I can just give you a quick example of one where they'll bring the community together, they'll have someone pretend to use the restroom, clean themselves with their hands, rinse with water, and then go around and shake everybody's hands in the community. So it's really trying to make very clear that if you're not washing hands with soap after using the restroom, you basically have, feces on your hand that you're spreading to your neighbors and others. And as a result of those, when they tested those triggering tools, they actually saw an increase of hand washing by 69% as a result of those efforts. So that's very encouraging. UNICEF also showed us that many countries are integrating hand washing into their ODF protocols, which are basically the guidelines for when a community is certified as open defecation free. So in order to get that certification, many countries are now requiring that hand washing stations with soap and water are included with improved sanitation. In Zambia, UNICEF as well, when they did a 6-month follow-up after the hand washing activities, they found 76% of toilets that had hand washing facilities, and 51% of people were washing hands with soap, 34% with ash. So also very encouraging results from their integrated program. So then UNICEF did a survey of all of their community total sanitation programs, and while everyone really felt that it was very important to include hand washing in their programs, they did feel like it was the most difficult to tackle and sustain. And this is just a map from the UNICEF presentation that shows the broad geographic range of where all these community total sanitation programs are being implemented. So and this is growing, and I think this is a really important area since we've seen success by integrating hand washing into this, that we continue to promote the integration of hand washing into community sanitation programs. Okay, last topic, hand washing advocacy. We did take the opportunity as the partnership to talk a little bit about hand washing advocacy. Many of you may be aware that the UN's Millennium Development Goals are coming to an end, and they're in the process of developing the next set of goals. There's the UNICEF and World Health Organization Joint Monitoring Program, which is JMP, put together these proposed targets where you can see hand washing included as universal access to hand washing or to hygiene in household, schools, and health facilities. So this is something that we're promoting, that we encourage everyone to take and promote, and really whether it makes it into the post-2015 goals or not, these are great targets to encourage any government to take on any donor that we should all be working towards for hand washing. I think one of the ways that we're doing this as a partnership is we're going to be developing a hygiene pack of communication tools, so talking points and PowerPoint presentations on hand washing. We've actually found that many people in the wash sector know how to talk about water and sanitation, but they don't really know what to say about hand washing besides it's important, and maybe that it reduces diarrhea. But we've got a lot of talking points about how governments can invest and how they can actually impact hand washing. And I think it's important that everybody in the sector has those talking points and can speak strongly about the importance of hand washing and why everyone should be investing in it as we go forward. A few other brief findings that we came out of the think tank was, one other thing we talked about was, I touched on this briefly, but what makes people start to wash their hands, and then what does it take to make them sustain hand washing? And we're starting to feel like there may be a difference. It may take different motivation or a different activity to get people to start doing the behavior, and then we might have to shift to other types of promotion activities to get people to continue to washing their hands. That may be where the social norms approach comes in. That may be where the more durable product is needed. So that's an area that we want to continue to explore, and I'd love to hear experiences from the field on that topic. WSP has a new hand washing toolkit online. There's a lot of great resources. UNICEF has just published, I think in partnership with the University of Buffalo, a great new hand washing monitoring and evaluation toolkit with many downloadable templates and tools that can help you in monitoring and evaluating hand washing. UNICEF also did a quick presentation on a new 3-star approach to schools. So it's a ranking of schools wash facilities and work where they can move from a 1-star to a 2-star to a 3-star, and hand washing is part of that rating system. There's also a new report on child feces disposal. This is a whole another area related to hand washing that hasn't really gotten a lot of exposure before, but we could be hearing more about it as in the future. And then there's 2 recent pilots that recently published their results that I think are really interesting and encouraging. One is from Unilever Lifebuoy. Just last week, I think it was released results from their hand washing program in a community in India, where they saw a reduction in diarrhea from 36% to 5%.
All right, so I think we're ready to move on to the questions now. We did have some comments regarding the products. Carl Bridge mentioned that he agrees that tippy taps are vulnerable, and he's found that hand washing stations with mirrors are feasible where he works as well. So that's great to know that this kind of new innovation is being seen besides just the marimba, and it gives us a good way of thinking about what are other ways we can be creative in getting people to wash their hands. And then Thomas Carter had some comments about the products as well, that they have purchased inexpensive plastic taps that can be attached to various containers to provide wash stations for schools and homes. And then also that they distributed potted plants to put below the hand washing stations so they're watered as hands are washed, which is something I have not heard of, but that's another great way to encourage people to wash their hands and then also use that water for another purpose. We received a question from Beatrice Keller regarding Elena's presentation, that most of the studies relate to hand washing and diarrhea or pneumonia, and are there other diseases to which hand washing is related? And that's a great question. There are other diseases that hand washing can help prevent. I know there's been some emerging research about soil transmitted helminths. Elena, do you have any other commentary that you can provide on other diseases that might be prevented by hand washing that you've seen in the research?
Hi, Hannah. I do. Thanks for the question, Beatrice. There is some evidence of other important diseases or health effects. Hand washing with soil transmitted helminths usually comes in a package. From what I've seen in the recent evidence, for example, there was a large campaign published in New England Journal of Medicine that I believe came from either Indonesia or Vietnam that had some very impressive results. One component was hand washing, and then there was another study I believe it was from school children in Tajikistan, that also showed improvements or I would say decrease in soil transmitted helminth infections and improved hand washing. However, all of those were packaged within a much bigger intervention where hand washing was a component. It's still important to note those were. Another pretty consistent finding for hand hygiene is eye infections. There's actually evidence for a reduction of eye infections, both with hand washing and face washing. Trachoma, to be specific. And there is a lot of work being done around neonatal infections to understand that a little bit better. The role of hand hygiene during birth and neonatal infections. A lot of the data for that right now is not very strong, so it comes from observational studies. But I would say that so far the evidence does suggest that their hand washing can prevent diseases or neonatal-related infections around birth. Those are the ones that come off the top of my head. I don't know of any more.
Excellent. Thank you. And we have a lot of questions. We might not be able to get to all of them, and I apologize for that.
Hannah, I could just try to answer quickly the ash question.
Okay, great.
Soap is ideal, but ash is also effective. It serves to actually physically remove oils from the hand and potentially germs as well. So we have seen it be an effective substitute when soap is not available, although soap is ideal if you have the option to have it. But ash is an alternative that is promoted in many areas and can be effective in cleaning hands.
And you can use leftover bathing soap for hand washing too, right?
Yeah, any kind of soap.
Okay, great. And then we have another question about, is hand washing without soap, it's more effective than not washing at all? Is there evidence to support that?
Yes, actually, Steve Luby did the study last year. I think it was the year before, and Yelena can correct me if I'm wrong, but they did a study of washing hands with water only. And they actually found that if you wash hands with water only and you rub vigorously enough, you can actually get a very effective cleaning of your hands. So it is good. And we talk about a hand washing ladder too, about, if it's difficult to get soap, maybe you just start encouraging people to wash with water and rub vigorously and then move to soap. I mean, it may be sort of an interim behavior to get you to washing hands with soap.
Yeah, the study was a few years ago, but it doesn't matter. The evidence is still holds true. Steve Luby and his colleagues, they just showed that there's this incremental effect in health effect where there's basically no, if you don't wash your hands, then the rate of, I think it was diarrhea, is pretty consistent. And also I think they're reported on respiratory syndromes. If you wash your hands with water alone, there's some improvement, and if you wash your hands, or at least one hand, with soap and water, there's even more improvement, so there's an incremental effect.
Great, thank you. So the question is about the midday meal scheme in India, where cooked food is served to students. Can UNICEF initiate the efforts for developing hand-washing behavior among students by supplying free sample of hand-washing materials to students?
That's a good question. I don't know if there's anyone from UNICEF that knows about the India program that could raise their hand. I know that India has passed this policy of having group hand washing before midday meals, but I don't know how they're actually doing it and how the provisions of soap are being made. So if there's anyone from UNICEF that knows some detail on the line, could you just type a note and we'll share that with everyone. I saw the question as well on what solutions for vulnerable communities from conflict situations. Communities need to have more soap, but no partners to offer the kind of projects. And specifically, they're talking about the DRC. The question is, can participants develop some projects in DRC? I think, depending on what the situation is, who might actually be in a position to be promoting hand washing, especially under the conflict situation many find themselves. I mean, the partnership can certainly offer tools and advice on how to do a program. Other than that, we'd have to find out if there's any other organizations already working in that area on WASH, but feel free to send us a special notice on this with your email, and we'd be happy to have a follow-up conversation about it. I know Yelena actually has been and her team has been looking into hand washing in emergency situations. I don't know, Yelena, if you have any top line messages on that.
Well, I think the question is more about when, it sounds like the question is more about when there aren't programs in place. My understanding is in response to conflict, depending on the type of conflict in the area, there are response mechanisms either through UNHCR or through different agencies. And my understanding of that is that those response, but with food rations or, you know, that's just for UNHCR, but with many other agencies that are involved in emergency responses, that soap is typically used. Now, in situations where there is no response for some reason, or where the conflict is high and things can't run, I'm not sure. We haven't tackled that yet, but I can try to see if I can find any resources on that when there is no soap available. I think encouraging the behavior itself, so hand washing with water alone, or if there's an ash substitute, is better than no hand washing at all, and there is evidence of that.
I see also a question from Matthias Saladin about regarding the products. What is the experience with the hand washing bag, which is promoted and developed by Bushproof Bodil Products? I can't actually see the link right now, so I'll take a look afterwards, but I have seen other bag type hand washing devices, and I think, you know, different products work for different markets. So I know in Vietnam they tested a plastic bag approach that hung with water, and the market, you know, the users just really didn't respond. They didn't like it. But I think that's part of the importance of testing in the market to see what works for different users. But I'll check that out afterwards.
One important way is through contact, whether that's through hands, whether that's through fomites like inanimate objects, like a table or a doorknob, or whether that's through air. There's different solutions for that. Hands are undoubtedly a part of transmitting respiratory diseases through contact, including pneumonia and a multitude of acute respiratory infections.
Great, thank you. And then we have some questions about kind of the sustainability. Are the hand washing stations typically public or private households? If they're in a public space, is there a problem with vandalism and then theft? And then there's another question that's similar about hand washing stations in schools. An individual who's working in Laos, and they're finding that the school teachers are finding it very difficult to provide soap. And I know in other schools there's been issues with soap being stolen or not replaced. Does anyone have any good ideas about how we can address those sorts of issues relating to vandalism or theft?
Yeah, I mean, I'd love to open that up to the participants too, who've probably dealt with this and tried different techniques. I mean, things that I've seen or heard about is that soap is kept locked away during off hours of school, that the hand washing stations are in places where they're visibly seen. Soapy water is used instead of a bar of soap. You can actually turn bars of soap into soapy water, which apparently in some places is some more difficult to steal or less attractive. So there are some techniques out there for trying to deal with that issue, because that is a challenge. And I know in the Philippines, for example, the Fit for School program, they really brought together the community to actually construct the group hand washing stations in the schools, and they, I think in some cases, you know, provide funding for that. So I think if the promotion of hand washing is thought of as a community activity, if the community is engaged in it, we've seen some places where there's a small fund developed for those materials. Some schools have health clubs where they raise money for soap and other wash products in the school. So there are some creative ways to do that, but certainly access to soap is always a challenge in many places, as well as access to water. So something we continue to try to tackle, but if that's something that you really want to look into, what solutions are out there, let us know afterwards, and we could try to connect you with people who've done that or addressed that before. Also, if there's any ideas from others, feel free to jot them into the chat box now.
Great, thanks Katie. So I think we have time for one more question. We have a question from Camille Sade about different behavior change communication approaches for children and caregivers and parents of small children. I know that in the think tank we talked about that there might be different behavioral determinants for hand washing. You're motivated differently if you're starting a hand washing behavior or if you're continuing it. So is that true in our behavior change communication approaches for children and caregivers and parents?
Yeah, I mean, I think it is different. I think that's the real challenge of hand washing, is that the person washing their hands and the critical times for them washing their hands, they're all such different episodes. You know, there's a huge difference between a child learning to wash their hands after using the toilet in school to a mother washing their hands before preparing food for their children. I mean, those are very different audiences. Those are very different times for behaviors and triggers. And I think this is what we're starting to realize, is that we have to be a little bit more focused, that just doing general hand washing promotion may not address all of those different needs of different audiences and people. So I think we need to be clear sometimes in our programs about whose behavior we're trying to change, because I think that can help focus the intervention on the design a bit more. With that, I'd like to thank everybody for taking an hour out of your day to talk hand washing with us. We really appreciate your participation. I hope it was helpful, and we will be in touch over email.